Good afternoon, everybody. Welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School here at Washington University in St. Louis. We are so happy that you're with us for today's program. I want to welcome everybody joining on the Zoom webinar. Let you know we're going to be using the Q&A feature today to moderate audience questions. Extend a special welcome to people joining on YouTube, either right now live or perhaps catching this recording later on. Want to make you aware that we're not able to moderate questions through YouTube, particularly not if you're watching us in the future. But before we get started today, I just want to invite you to the other programs we have going on at Open Classroom this week. So we're going to be back on the air tomorrow. That's February the 9th. Dr. Amy Conroy is going to be with us. She's with the University of California, San Francisco, and she'll be sharing her research on leveraging the couple relationship to improve HIV treatment outcomes in sub-Saharan Africa. That's a program we're offering in partnership with the International Center for Child Health and Development. And then we're back on Thursday, that's February the 10th. We're going to be joined by Shang Wei from Washington University's Olin School of Business, contributing to our Artificial Intelligence in the Social Sciences series with a talk that considers the question, does machine translation affect international trade? So just a sense of how broadly we go and the types of topics that we take at Open Classroom. You are welcome to come back for anything and everything, free and open to all. But today, I'm joined by my dear friend and colleague, Cynthia Williams, our Assistant Dean for Community Partnerships. I almost gave you a promotion. She's going to help moderate the Q&A. And it's now also my pleasure to introduce the moderator for today's panel. Interim Co-Dean Rodrigo Reis is a professor here at the Brown School, a former Associate Dean for our Masters of Public Health program. Rodrigo teaches courses focusing on the built environment and public health. He's the chair of our urban design specialization. To lead today's discussion and get us started, I'm happy to turn the microphone over to Rodrigo.
Thank you so much, Janet, Cynthia, and all the organizers. This is a fantastic panel, and it's hard to believe it's been 2 years or so into the pandemic, and we are still learning new things and learning new good things as well, and amazing progress in the things that we have advanced in our region. The panel today will be talking a little bit about that. So challenges, opportunities, and things that we learn. So without further ado, I'll pass to my dear colleagues in this panel today, and they will introduce themselves and give some background here. I will start with Dr. Mati.
Hello, my name is Dr. Mati Hlatshwayo Davis. I'm the Director of Health for the City of St. Louis, and I am really excited for this discussion today. Thank you for having me.
Thank you. And Archibald-Clabon.
Good afternoon. My name is Archibald-Clabon. I'm the CEO of CareSTL Health. I'm excited about this topic, and thank you for having me.
And Angela Brown.
Good morning. I am Angela Fleming Brown with the St. Louis Regional Health Commission, where I serve as the Chief Executive Officer, and very excited to be with this esteemed panel for this discussion today.
Wonderful. Thank you, Angela. And for the last but not the least, Dr. Jason.
Hey, everybody. Jason Newland. I'm a pediatric infectious disease physician here at Washington University and St. Louis Children's Hospital. And I just can't thank everyone enough for giving me this opportunity to speak with all these wonderful people that I've been blessed to get to know over the, unfortunately, it took a pandemic to get me to know these folks, but I look forward to more relationships as we move through this. So thank you all.
Thank you, Dr. Jason. And as I said before, 2 years into the pandemic, our region has gone through those difficult times, but I would say also very, important times for us to learn how to improve equity issues and health throughout the region. So maybe we can start talking a little bit about how the virus has impacted our region in St. Louis. What are the key stakeholders, infrastructures and resources that were developed and are still needed here in the region. So maybe can you speak a little bit about that? So how the virus has impacted our region and stakeholders and resources, how things have been played out here for us. Does anybody want to jump in first?
Yeah, I'm happy to start. So in my introduction, I am currently the Director of Health for the City of St. Louis, but my background is I'm an infectious diseases physician, and I also have a public health degree. And so prior to the pandemic, I was in mostly clinical practice with a passion for community engagement within St. Louis. So I remember when this started as an infectious disease jock, and I know Jason can join me here in kind of how this happened, was, this was being announced at sort of the world stage, and then came to our shores here in the US. And most of us who are in infectious diseases were in these meetings, right, where we were kind of charged with leading the fore on how to advise and educate and plan for this. And I remember all of our bosses around the time telling us to prepare to be in this position for at least 2 years. And here we are in year 3, still tackling this. And we've seen the devastating impacts it's had across the board within the region. I would say that, you think about this from different factions, clinically, how this is affecting people, but there's pre-existing disparities that COVID-19 joined a long list of that were just increased. And I know that Angela work and have led the region through those areas for years and years now. And we saw this across the board. So I think that's a good starting point. Here at the city, we know that the African-American community has shouldered the burden of COVID. 76% of all infections at one time or another around that number, has been attributed to the African-American community. We know that there's other at-risk groups that have continued to bear the brunt of severe disease and death. Our elderly population, our immunocompromised population. And unfortunately, this isn't new, right? So the question is not so much what did COVID do, it's COVID joining a long list of disparities for which this is true, and really, I think, helped propel the region into how do we finally agree with these disparities that COVID continued to shine a light on, and what have we put in place to do that?
That's a great way to start this conversation. Maybe Angela and Angela, how do you feel about what are the other stakeholders and organizations? How are a community really organized to tackle this together with Dr. Jason, Dr. Mari, addressing clinical elements, epidemiological elements? So how has our community been organized through all of that?
Okay, I'll speak to federally qualified health centers. And so for the audience who may not understand the role of a federally qualified health center, we're entities that are located throughout our region. Our responsibility is to take care of a community. Wherever we have a facility in that address, we're responsible for that community. So for us, our health center, we're located in North St. Louis. And as Dr. Madi mentioned disparities, some of the disparities that I was not expecting. But as the CEO of a federally qualified health center, we're mandated to respond whenever the federal government asks us to respond. So FQACs were called upon by both administrations to actually help with the testing, definitely when it was time to vaccinate communities. We understand disparities. And so for me, as the CEO of an FQAC, it was my responsibility to stand up and speak up for our community. We probably forgot because it's 2 years ago that North St. Louis was even left out of testing. And so we had to fight for that and those things, and we're still fighting. But the biggest disparity, that's the silent disparity for me, is losing our workers. We lost providers when the pandemic first started because many of those providers were seasoned. They were dealing with diseases, and they felt that they were at risk. We had about 3 or 4 providers retire. And so that's a disparity when you're responsible for serving a community that's at risk. And the federal government, they fund us and provide incentives for persons to come and work in North St. Louis and in communities that's blighted like ours. But the pandemic caused this exodus out of our community that we're still fighting with, even though every day here at our health center, we will be there for our community doing what we can. But those are some of the strategies that we just work on as a group. So all the federally qualified health centers, there's 4 of us in the region, and along with some of our safety net providers, we respond. I just have to take my hat off to this region. We have responded and changed with whatever storm they threw our way, being able to communicate, even communicating and having a panel discussion has helped us learn and grow in this. So those are some of the strategies for us, is staying together as a safety net, however we can. And I just wanted to make sure I share that from an FQAC perspective.
Thank you, Angela. Angela, I think I see you're agitated to say something, please.
Yeah, just to build off of Dr. Madi and Angela, with the disparities in our Black and Brown communities and really the lack of testing at the onset of the pandemic, we also noticed the lag in communications and education out to those communities as well. And so through about 8 community-based organizations, along with our city and county health department, started an initiative called CareSTL that was really focused on communications and outreach engagement to the Black and Brown communities to make sure they had the information and also the tools they needed to prepare for COVID and also survive this pandemic. And so I think we saw a lot of we intentionally called it Prepare, because we were maybe a month or 2 within the pandemic and many people thought we should be saying stop. But what we noticed for those Black and Brown communities, they didn't even have the information to prepare. There was a delay that they were even being impacted by COVID-19. And not only were they ended up being the community most impacted, but they had definitely a disparity in deaths. And so really making sure that we had those educational messaging out, wear your mask, wash your hands. And one of the biggest, and social distance, or physical distance. But one of the biggest things that we noticed is that they didn't even have access to masks. So we thought would be more just education and communication turned into how do we put masks in the hands of these communities where they didn't have access. And even if they did have access to the masks, they were priced out of reach. Kind of the same thing we saw once everybody said move to the N95 mask. They finally got the surgical mask down. Amazon was $100 for like $10. Looked up N95s, they became $50 for like $25. So definitely, pricing people out of that market, and just the delay of making sure individuals have access to those tools that are needed to do many of the mitigation efforts that have been promoted by our leaders in this space.
Hey, Rodrigo, I just want to add, to the conversation, a couple of things. One, as a pediatrician, the impact on children, the way we've looked at it has changed dramatically. At the first of the pandemic, and Madi, when you were talking about them, our boss is saying 2 years. I was like, really? Come on, really? Boy, they were right. But I would say, think about children, right? We began the pandemic, and the message was, hey, thankfully the kids aren't as impacted. They just don't seem to be impacted. But you know what? We were short-sighted. I was short-sighted. I wasn't looking or thinking, about our children the way we need to think about our children. Is that all the things around them that's necessary to support them that honestly aren't really always there even prior to the pandemic. Let's talk about mental health, right? We had a mental health pandemic in and of itself prior to the pandemic, right? We had mental health problems prior to the pandemic. We should all know that. This isn't new. Mental health is just getting exacerbated in our kids and in our adults, but it's exacerbated by the pandemic. We didn't think about that. We thought we knew we had to shut everything down because we didn't know, right? So we shut down schools. And that was right. We needed to do that because we didn't know. We didn't want some of our most vulnerable to be potentially impacted dramatically. But we then failed to forget about how important schools are to our community. And I mean our community. And I say this as what a white privileged male, a white protected male as well, right? I mean, let's be clear. I realize where I stand. And that meant we have the disparities we've learned from the systemic racism that's been prevalent throughout our region. But that impacted our children, and we know that with schooling as well. And as we saw the more privileged or the more resource rich or however you want to say it, they all went back to school sooner. They all had supports to go back to school sooner. And we kind of pushed and knew, but part of that's because of the disparities we talked about. The fact that we knew that, right, for 2 months, the only people that have really died in St. Louis of COVID-19 was our brown and Black people, right? We learned that. I remember hearing that and going, oh my goodness. And so I think that as we move and as we learn, children had taken a brunt from schooling, from now, not being in school, now going to virtual, and while we said we provided, our community provided all of this stuff for people so they could do it. It's not as simple as that, right? Like, yeah, we'll give them hotspots, we'll give them all these things. Doesn't make it easy. Doesn't mean getting on that in a family, a multi-generational family where people have to work, maybe a teenager now that's going to work instead of going to school because that's what they need because the essential worker now can't. That was the reality. And kids have taken a brunt.
I think this, Jason, thank you so much for the perspective, Angela, and Mari. So just look, maybe one provocation here before we move to another topic here. But so how all this situation, because I learned from you all that you learned so much about how to how to resource our communities better, and what are the weaknesses that we have, and what are the new things that we learn, like Jason just brought up about kids, where how schools are were underwhelmingly unsupported throughout the process. What all those things that we learned, and how do we, considering all the things that we learned, how those things will inform future action?
Yeah.
What do you think is going to change in the coming months or coming year regarding the pandemic and health disparities in the region, based on what we have learned?
Yeah, I'll happily start. So what I love about where the conversation has taken us is, we talked a little bit about where we started, and Angela did a beautiful, both Angelas did a beautiful job of taking us to where was the community in the beginning of this pandemic? What did we need to do to start to mobilize resources around Prepare STL, our FQHCs, who have always taken the lead when it comes to these things. Let's be very clear. And I don't believe have always been given the appropriate budget and resources to do so. And then Jason talked about all of these exacerbations in disparities that have happened. So I'd like to address the sort of where are we now and where are we looking towards. So I can't speak on behalf of my counterpart, Dr. Faisal Khan, but I will say that we meet together monthly and made a commitment to do so when I took this position, because one of the things that I felt very strongly about was we weaken the regional response by continuing to work in silos. A lot of people are doing a lot of excellent work around community engagement and around implementation and dissemination of these needed resources, but they're happening in silos. And not only does that mean that certain groups are left out, but it also means that we miss an opportunity to ensure that we have a strengthened vision for the region. So one of the things that we've done in the last 4 to 6 months is ensure that the city and the county are meeting monthly to share our priorities and also to then collaborate where it makes sense. So because we're not, our organizational structure and our ability to do so, our ability to enforce what we want to do legally is different. We can't always do that, but that has helped. For me, it was important to say that anything we do around COVID and the COVID response has the foundation of equity. And in order to do so, in order to respond to these pre-existing disparities that have since been widened, all of our initiatives around COVID, whether it be vaccinations, testing, I always go to our FQHCs and community leaders first. There's always an email that goes out to RHC, IHN, and our 4 FQHC CEOs to say, this is what I want to do around COVID. Any thoughts or feedback? And that is because I think that we have really missed the mark around what trusted messengers are and trusted resources, and allowing our FQHCs and community partners who've already earned the trust of those communities, where there is valid mistrust and distrust based on centuries now, but dating back to slavery, Tuskegee experiment, so many other historical and current examples of systemic and individual racism that need to be overcome. So that was important, is equity. And what does equity look like? Well, it's allowing our FQHCs to come to the fore. And I'll tell you that we've seen great success. When we partner with FQHCs around vaccination clinics, testing, when we go to clergy advisory boards, when we go to school leaders, because I meet weekly with our superintendent and all of the leadership of the different school districts. When we center our vaccine clinics in those places of trusted messengers, we have by far our largest turnout of folks and people who come in. So that was important. I also think it was important to have a multi-layered approach to the pandemic. So vaccines education, which means town halls and things of that nature, and then mitigation strategies like the hand washing, the social distancing, et cetera. Moving forward, we know that we're in this awkward position where it kind of feels like we're getting this message, this indirect message from the federal government and possibly the CDC about the new normal and endemicity being here. Very frustrating for people like Jason and I who have done this work, because you can't say that in the middle of a surge. So we're at the record highest surge that we've ever been in, but hey, let's start throwing around words like endemicity. But what it's done especially in a climate where in Missouri, we unfortunately have a governor who, in the midst of a surge, also removed emergency powers. So we couldn't do a lot of the work that we've done. Also have an attorney general who is literally suing schools and public health agencies and stripping us of our power, has forced us, and I'm really proud of the region. Our pandemic task force meets twice a week and has continued to do so. Like I said, these strong relationships with our FQHCs and community leaders has meant that it has forced us to really look at what is the role of public health and how are we going to enforce that. My last plea here is to say it's been made even more difficult by the fact that Missouri is one of the most underfunded public health states in the country. And when that trickles down to local jurisdictions, it means we have very limited budget to do this work. And we have staff that are underpaid and overworked who are burnt out. And so we cannot do effective implementation of these strategies. So while that sounds like a little bit of a dim or negative or lacks hope perspective, it's the reality of where we are. I'm very thankful for organizations like MILSEFI, LPHA, and other public health entities that have brought us together to try to do this collectively as a region. But the implementation, dissemination needs funding, needs policy, and needs support from the state level for it to be successful.
Mati, thank you so much. It's this whole conversation was a wonderful way for us to start the panel, learning, revisiting what we have learned and how we have done things. So maybe I will invite the four of you to come with me to the next sort of set of provocative questions. So where we are now in terms of vaccinations and new vaccines. So we just want to throw a broad question of how is the hesitancy, playing out in the community right now, and where we are in terms of new variants, new vaccines, because that's what's really what the conversation is happening now and across the nation, especially in our region. So what can the four of you tell me about that?
Before the scientists speak, just let me get my little social piece out in regards to hesitancy. For me, when the vaccine first started, I was the first one to raise my hand in my organization. I'm going to get vaccinated. And that was a movement that, as Dr. Mati mentioned, the staff in the community started trusting by watching me to get vaccinated. And so I'm fully boosted and all those things. And for my vacation for Christmas, I tested positive for COVID. And so everybody's like, whoa, wait a minute. How could Ms. Clabon get COVID with following all the rules? And I still don't know the answer, and they don't know the answer. But for me to say, okay, I did, there's some breakthrough cases following the government, listen to this, just really trying to make sure that we understand. For us as a community, it is okay to say, I don't know what's happening. And that's part of the trust. For me to act like I know what's happening, then they would not trust us. And so and I share with Dr. Mati, majority of my staff, you all know the federal government mandated FQHCs and healthcare system to get vaccinated. I lost some really, really talented people who refused to get vaccinated. And so that was something that we had to deal with. So now some of those employees, about half my employees, they're at the next stage of receiving their booster shots, and they just hit the pause button because of the breakthrough cases. And so I really just want to say this publicly, and Dr. Mati, you really are the city health department is definitely underfunded. Where you can't serve, FQHCs can, and we're underfunded as well, but as a team, we do a much better job. And so I really want to say the gift card helped with a lot of issues. It truly was a game changer for our community. We were having some issues in moving the needle. And the gift card program happened during Thanksgiving and on Christmas when the people were in need, and they participated. And so now the city has changed some of the standards, and people were hesitant to receive the booster shots. And the gift cards caused them to say, okay, maybe I will, even though they don't have all the facts, but they have so many needs out there. The social determinants, the housing, all those things are very real. And they're trusting this community to get it right. as they trust us, as we say, get your booster shot and your vaccine. There's a lot of issues out there, but they are watching us and they are trusting us. And I just want to say that from my perspective, I don't have all the answers. I can't speak to that. But I do want us to not take advantage of our community and their trust. It is okay to be transparent that you don't have the answer, but educating them on why it's so important and using all the voices is very huge. And I just want to get my piece out. And all this for doctors, they can speak on the rest of that, but they have to trust us and we have to be transparent and honest with our information.
That's wonderful, Angela. Thank you so much. Go, Jason.
Yeah, Ms. Clabon, I just want to say thank you, right? Thank you for sharing your story. But, what I like to tell people that, have been vaccinated and boosted is I say, hey, thank you. Thank you for being vaccinated and boosted. I understand you've gotten COVID, but you know what? All of us healthcare workers, all those people on the front line are thanking you a million times right now because we know you're not in the hospital because you were vaccinated and boosted. Our data shows that, that vaccinated and boosted is what's kept people out of the hospital. And, I'm sorry you got sick. And some people are like, man, I had a really pretty good illness. I felt pretty miserable for 4 or 5 days and I was vaccinated and boosted. Like, really? And I'm like, yeah, I know, but thank you. You're out of the hospital. You're alive, right? For some, that means life. I think what vaccination and boosting has done is, we've changed potentially fatal virus, right? Something that can kill you and made it a common cold. And I'll take a common cold if you're going to keep my loved one safe. And I think that's the message, right? And that's our continued message. And I just say from then on out, I think the variant piece is what's changed things. And thankfully, we're just dealing with Omicron. And now we have the cousin of Omicron. But I will say from my perspective, the cousin of Omicron is like, okay, fine, we're going to be okay with it. But it's it's the future variant, it's the pi, it's the omega, it's the whatever that we're all going to have to learn about next.
Right. Well, no, you actually are answering a few questions that were raised in the chat here already, Jason. So thank you so much. Because people are really raising questions about what about these new variants? Should I really get boosted? That people are still asking those questions. So what I hear you say, boost. We need to get those boosters out there. No, we are not only protecting our valuable and important health workers, such yourself and others, but also helping people to get to be being protected. Doesn't mean that you're not getting infected. It means that you're getting less likely to be experiencing severe disease or something like that. So I think because people are asking here in the chat, should I really get the booster or not? Is this really working or not? So it's a conversation that for some folks it's hard to really grasp. Well, how can I be vaccinated and still get infected? Those basic questions. So that's what I'm hearing you saying, that we need to get those boosters out there, right?
Yes, please.
Yes. And I'll just add to this that one of the things that people said throughout this pandemic that added to the mistrust, and I don't use the term vaccine hesitancy because one thing I learned at the beginning of the pandemic is that there's nothing hesitant, especially in Black and Brown communities, about the questions that they have. These are valid questions, valid reasons for mistrust. If you have been failed time and time again since slavery, abhorrent things in the name of science, right? Throughout time, and even now, all of these disparities that happen within government institutions, healthcare institutions, people have valid mistrust. So the term that I like to use is vaccine confidence, because it then puts the responsibility back on us, the providers, the leaders, to instill that confidence by providing education and resources so that folks can get vaccinated or make the best decisions for themselves and their family. I will say that we have to take responsibility from the top down. Federal government, CDC, state, local health departments, everybody has to take responsibility for confusion, because a lot of people's criticism is, well, at the beginning of the pandemic, it was, we do need masks and we don't need masks, and now we do need masks. People will say, well, we were told vaccines will definitely make you not get COVID. Now we're told you could get breakthrough infections. Now we're told it may not even help with certain things and only boosters help. And I think the messaging that should have been more clear from the beginning of the pandemic, that Jason and I know full well, because this is our discipline in infectious diseases, infectious diseases are not a monolith. They're not static. They're not the same. They evolve over time. And the quicker you get to herd immunity, the more likely you don't have to deal with updated and changing policies in response to those changes. But the policies change as the variants also change, and with them bring more severe disease or the ability to evade or get away from the existing protections we have. So for our earlier variants, masking and just getting vaccinated was enough. But as Delta came and now Omicron, we know that it has evolved, right? It has caused mutations such that it's not going to be as effective. It requires that added level of boosting. It requires all of the mitigation strategies at once. And even then you have a chance of getting it. But what we know, what Jason has said is, if you are boosted and you are using all the other mitigation strategies, even if you do get COVID, you're less likely to be sick, on a ventilator or a breathing machine, or even to die. And that's critically important. I will also say around this topic of vaccine, a lack of vaccine confidence within our communities, that also is not static. People don't have the same questions and concerns as they did in December 2020, last summer, or even now. So it requires us to continually be engaging with the community, asking them what's going on. For me, that means making myself available for webinars, for panels such as this, having town halls so that people can debate, and even on social media. I'm an older lady, I have no business being on Twitter, Facebook, Instagram, but I have to use those to stay engaged because people are asking me questions and saying, why? Well, I don't believe this. And it's that level of communication and engagement that allows us to educate people better and respond. So my take home message is, it's important for us to understand that these things change over time. And the only ways we know what the changes are is to continue engaging with our communities.
It's just fantastic. I heard you saying that, building trust is fundamental. I love the way you're framing this, trusting vaccines is not vaccine hesitancy. It totally resonates to me. And, being raised in a developing country where infectious diseases are pretty much controlled for decades because of vaccinations, we sort of learn to trust in vaccines more than trusting governments. So I think that's the message there. I love the way you're framing that, Mati and Jason and Angela. And right now people are asking new questions. So I'm glad you brought that up, Mati. New questions are emerging, such as, should I get vaccines every 6 months? Should I have a 4th, 5th, 6th, 7th booster? So what's happening now? So should we be prepared to get yearly vaccinations for COVID? Should we treating this as a sort of an endemic disease? So tell me, what's next now? So what should we expect? That's what people are asking.
I'll tell you from my perspective, and I definitely want to hear Dr. Mati's thoughts too, because we don't know. We don't know. And as Mati just mentioned so nicely, right? This is evolving and we're learning, and part of this is learning. Let's learn. And I think the vaccine strategy going forward, we could give you a couple different answers, right? I could give you the answers. Yeah, we're going to see what the next potential variant might be, and they're going to, our vaccine, the way they're made can be change pretty quickly, give you a couple months, and maybe it's going to be like the influenza and we're going to get our flu vaccine. Don't forget to get your flu vaccine every year, because we know that kills up to 50, 75,000 Americans annually prior to COVID. So don't forget that. But that might also be a time you get your COVID vaccine. That is a potential strategy. However, there's others that have said that, look, maybe all along that we really needed 3 doses for this vaccine, that this series was always going to be a 3-dose vaccine series. We just didn't realize it at first. Then you are going to have to, and maybe the 3 doses is what we need, and that it provides enough immunity, enough memory, that maybe we aren't going to have one every year. I don't know. I wish I did, but that's kind of where I stand right now. I'm going to go with, I think it's going to be an annual vaccine, because that just feels like it's what it should have.
Yeah.
I agree with Jason, but I have a little bit more of a tough love answer to add here. Is this, again, is where I look at federal and national policy. There are countries that are much closer to their new normal because they did what needed to be done to hunker down, to standardize that across their communities, and to decrease the chances of variants coming. Variants breed when we create an environment for the virus to still be transmitted at a high level. And that is a direct result of not having clear and standardized policies to mitigate against COVID, point blank period. So when you put us in a position where different states can have different rules against mask mandates, vaccine mandates, lockdown, and things of that nature, you create an environment where transmission stays high, and in a high transmission environment, variants are bred. And if variants are bred, you bet your bottom dollar you're going to see a lot more boosters going on into perpetuity, right? But if we do get closer to herd immunity, and there's a great question in the chat about with so many people naturally getting COVID, are we getting closer to herd immunity? It's a converse. We know that people who get vaccinated have a higher degree of protection, and that is the primary mechanism by which we get to herd immunity. Not hoping that everybody just gets COVID, we kill off the most susceptible. I mean, how barbaric is that? And then just fingers crossed we get there. That's not the technique. So what I would say is, again, this needs federal leadership. It needs standardization. It needs tough decisions for us to hunker down over a short period of time to get us there. Otherwise, we will continue to see these peaks and troughs of new variants, needing to have more severe mitigation strategies, and then having vaccines that become less effective and require boosters or even new vaccines.
Right.
That's the tough love message.
Okay, I heard, sort of the way I'm seeing this is this. The providers are telling me this. Here's the evidence. This, like infectious disease 101 that Chase and Marty just gave us this lecture. Here, this is the vaccines war. This is the infectious disease war. This is what we know. So Angela, that message is getting through or not? So why people are not? Some people are still. I heard Archibald-Clabon talking about mistrust, historical mistrust. Now, you brought that up before. And how come this message that is clear, very sound in science, and grounded in science and very sound. So tell me, what is happening out there in the community? How can we make this message go through?
I would just add, I think it's clear here. So I was listening to Jason and Marty speak, and I'm like, I don't think that's what the community is hearing, right? So they said it very clear. I love the pieces that we're learning. This is a learning process. There are pieces of this that we don't know. I don't think that's what the community is hearing. CDC went, as Dr. Marty said, you wear your mask, you don't wear your mask. Now, if you have it, you don't have symptoms, you can go back to work after 5 days, you can be back out after 5 days. It's just confusing, right? And people aren't not tracking along of, this is a learning process, it's gonna change periodically. And how do you even keep up with all of that, right? So if you're on social media, somebody might have a post here, you may read it somewhere, you're hearing it on the street, but it's really hard to track and follow all of this if you're not connected. We all sit in meetings about this probably daily at this point, weekly, definitely. And so it's easier for us to track it, which, having that continuous message to the community is not happening at the same rate. And I also say, politics here has played a large role in much of this, where even the mask situation is now politicized, whether or not you wear masks and stuff. And so just really, I think for our community, having this clear message, we have to do a better job at getting it out there. And I love Dr. Marty's point about vaccine confidence. And because of CareSTL, we really took the approach of having an informed choice, which is pretty different from our regular healthcare environment, where when your doctor says it, you just do it, right? And so really answering people's questions where it's clear and they understand it, and they feel comfortable making decisions is really, I would say, I hope that's the future of our healthcare, but also what we need in order to make sure people feel comfortable moving in that direction and building that trust and relationship, and really engaging the community in the process differently than we have before. So those are my 2 cents I'll add for that.
And I'll add a little bit from my perspective. Information. Here at the health center, and I understand all the variants, oh gosh, people were testing negative with all types of symptoms. We were saying you didn't have it. The leaders weren't even aware of the different type of variants if you were not a healthcare provider. So we're sitting at the table And the next big issue is the at-home test. I can just speak to my own personal family. We have the test, we send them home, they doing the test wrong. They have no idea if the test is right, the results are right. And now it's this new thing that people are afraid to even know, they don't even want to know if they have COVID. And so they're just hesitant to even take the test. And so how do we get them comfortable with their at-home test? If you have a sore throat, if you have some type of symptom, take the test. And this goes back to, for me as a CEO of a health center, they don't want to lose hours at work because of the shortage, the workforce shortage. And government policies. And this is back to lack of resources and funding. That we're forcing people to return to work, whether they're sick or not. And those that are sick, if it's 5 days, 10 days, they have to stay home. If they have severe symptoms, they don't have PTO. The government rules change on those type of things. So now people are hesitant to get tested and are hesitant to say they have symptoms or not. And so we have to really make it comfortable for them to be safe to say, I have some symptoms. Don't punish them, use FEMLA and all those resources in the community. And this is one of the things, social media, we're underestimating the impact of social media, and they're the communicators of this pandemic for us. Here at the health center, it may just seem, to me at first, it was a small thing. But once I started talking to the staff, it was something serious. I do not have my facts right, but there's this message that now the new variant, taking it has something to do with your ability to have children. This is a huge issue. And I don't know if I have all the facts right with that, but that put the brakes on it for that young population. And for me in this community, as leaders, we need to speak to that. We are silent about that. If they're hesitant, we should be actually correcting that information. And how we do, what we should learn now is how do we speak to the myths out there in a timely manner, so that it don't manifest and or hurt our community, because they speak and spread those messages quickly. And so I just wanted to add that part to just respond.
It's beautiful how we have not really coordinated the answers, but everything is aligning so well. No, you are all brilliant. So no, we have sort of 15 minutes to the end. Then, no, a question that came up here, I think it's very, very interesting. And year 3 into the pandemic, now we are dealing with long-term effects of so many people got COVID, and unfortunately we lost so many of our dear community members. Family members, friends, and those that got COVID, they're still dealing with the effects. So how do you see these both on sort of the clinical side and then the public health side, but also in the community side, where people are still dealing with COVID and still have to go to jobs, and their capacity is not the same as it used to be. So what the 4 of you think about the long-term effects of COVID in our community through all those all those elements there I just threw out there?
And Rodrigo, thank you for bringing this up, because I think what we've all said here is vaccinate. Let's be vaccine confident. I'm stealing that all day long, Dr. Mati. I'm using because I'm the same way. I don't like hesitant. Confident. Let's get vaccine confident. And here's one of the main reasons, right? Is that this virus is bad. It's not like we've talked about it being bad, and it's killed over 900,000 Americans, right? We're over like 2,300 a day right now. Like, that's bad. But let's also be clear. You could have it to where you still feel symptoms 6 months later. And that's just in the adults. Let's talk about the kids, right? I said it, I started, kids aren't that impacted. Well, you know what we learned? Within 2 months of the pandemic, we started seeing normal, healthy children, okay? Normal, healthy children who 4 to 6 weeks earlier would have like a COVID illness, mild or no symptoms. 4 to 6 weeks later, they land in our hospitals in the intensive care units, needing blood pressure support, needing a breathing tube, needing things. This is this multi-system inflammatory syndrome. Like, this is bad. This virus is worse than influenza. It's one of the worst respiratory viruses we've had to deal with because of the long-term complications that vaccination protects against. Vaccines protect against multisystem inflammatory syndrome in children. It has been proven. It protects against long COVID, however you want to name it. It's been proven. And I can't stop because Ms. Clabon, brought up the fertility stuff, and we should talk about that. Is that one, no biologic plausibility, never been seen that it impacts fertility. And what's more important is that it protects the pregnant mom from dying, and because people are afraid it's going to hurt the baby, it's going to hurt their development. No, it protects the baby from dying in utero or having a miscarriage. That has been shown now in a number of papers. So long-term complications, vaccinate, mitigate, we will protect from people having those.
Loud and clear message, Jason. Thank you so much. I'll let my other dear colleagues to address that long-term effects of COVID in the community as well.
Yeah, Jason hit the nail on the head as always, right? Like, we talk about COVID in the now, but there's long-term effects that we don't know what it's going to do to the body. Anytime you're sick with something, there's a state of inflammation that affects different organs. We don't know what that's going to do in the long term. And we've always focused on myocarditis, which is a valid concern because we don't know if your heart being inflamed for weeks, for some people months, for some people longer, what is that going to do to your long-term health, heart disease, and just your life expectancy in general, but even more so in children who are still developing. Do we want to take the risk that even with mild symptoms, we don't know what kind of long-term developmental effects that's going to have? But let's expand our idea of the long-term effects of COVID to what is this going to do for mental health in our communities, for the exasperated disparities that we've seen. We're going to be dealing with the impacts of COVID and this pandemic for not just years, but decades to come. And part of what we should be doing this year as we're preparing for our new normal, preparing for endemicity. And I just want to pause here as an ID doc and a public health expert and say, you don't just decide that something is endemic. There are clear definitions and parameters which we have not met. So let's just start there. But it is appropriate to prepare because local public health agencies, community organizations, hospital systems, schools, all these major groups and areas that are critical to the way that we function as society need to prepare for what that looks like. We need to be thinking about how we respond to the long-term mental, physical, and societal impacts of COVID that I believe we'll be dealing with, like I said, for years, if not decades.
Right. To me, I always think, and by the way, it's obviously I'm a professor of public health. So to me, this is like evidence-based public health 101. Wonderful conversation. The four of you are really, telling us how good public health should be done. So I'm very thankful for you all. I always have thought about this is not only about individual health, it's collective health. No, protecting one is not enough, and not enough. Protecting all will actually make us all protected. So I think that conversation is a little hard to have sometimes, especially in the current climate. But we are learning new things, and we are still dealing with a few challenges ahead. One of them, what to do with vaccinations, or if those vaccinations will be ever approved for kids under 5 years old. So is this happening at some point or not? Because this is a concern. Now we have parents now really concerned going back to work and bringing the virus back to home. So is this happening or not?
This is happening. I think what we know is that the FDA, their external advisory committee, will be meeting on February 15th to review their external advisor, but will review the data from Pfizer's trial that is 6 months to the less than 5 years old age. We're all like, we heard this news last week and we're like, whoa, what? There must be some data that none of us, that they have that is hopefully positive and that we'll learn. And if that leads to that emergency use authorization that we've all gotten accustomed to, those 3 letters, EUA, gets there and the FDA says, hey, yeah, we'll grant emergency use authorization. Then it goes to the CDC and the advisory committee on immunization practices, and they'll meet the following week, most likely. It's probably already scheduled. I just haven't seen it. And then that committee will potentially recommend or say, hey, there's not enough proof. But I think we're all, because of what we've seen previously, we're all hopeful that will happen. Now, with all that being said, there's other there's Moderna that's doing their vaccine trials down to the youngest age group that's going through the same process. And there's a whole nother, I mean, what the beauty of our country has been is medical science. And the reason why we could have a vaccine as quickly as we did is because there had been decades of work on coronaviruses. People have been working on the COVID before they even knew there was COVID-19. And that's helped us get to this point. So I think there'll likely be second generation vaccines potentially later. But short answer, Rodrigo, yes, we will have a vaccine for 6 months to 5 years, potentially by the end of the month.
Okay, so let me put Angela and Mati on spot then. So should we be expecting the people not trusting that? Should we expecting communicating things differently? So this is happening. So we should be anticipating things. So what the three of you think?
I think with information and communication, building confidence, and I'm gonna steal this word, they will trust us. That's what I was saying initially, that just being transparent, you need to get vaccinated, you need to have your children vaccinated, and being consistent with that as a team. The CEO of the FQACs and the safety net, we meet regularly, we check on each other. What are you saying? What are you saying? What are you doing? And just be transparent. I think they will. I'm a little disappointed in the numbers for children. I think this is something related to not being able to get into the schools to help educate, because they open, close. And so we just really can't do a lot of work there. And I think we'll make some progress there. But I think if we're consistent with our message, we build confidence and just be transparent, I think they will do it. They're watching, they're waiting to see what we will say, and feedback and hearing us talk for persons who live in the community and don't have it. How do you get feedback from me on what happened to me with my side effects for COVID? How do we get feedback from the community so that we can address those issues? Having a platform that they can trust and ask questions and get reliable answers, and or say, hey, this is happening to me. I had COVID. I have COVID legs. Make up something. I don't know what they say. But having a platform, I think that's the next step, that they can trust to get a response and be educated by the platform. But I think so. It's educating them and using the systems we have, FQACs, hospital systems, their health departments. They'll respond.
Yeah, Angela's right. We have had an alarmingly lower rate of uptake of vaccines for the age group 5 to 11 than we have for any other age groups. That makes sense. I am a doctor, I'm a public health expert, but I am mom first. And when it was time for me to evaluate the data for my 5-year-old, she was 4, she was 4, and I was anxiously awaiting her to turn 5. That was, and my husband's a pediatrician, so you couldn't have a household that has more knowledge about this than our household. But when I tell you, when I suggested to my husband, let's enroll our baby in the trial, he even said, hold up, I don't feel completely confident about this. So let's then extrapolate that to people in the community who may not have access to the same resources or health literacy, who are parents or caregivers or folks in the position to make these decisions. It makes sense to me why the vaccine confidence is lower, as Angela said. And in the city, what I will be initiating within the next 2 weeks is reaching out to Black and Brown pediatricians and health caregivers to join the city in a campaign around educating caregivers and parents. It's again working with our schools and our FQHCs around these platforms. But yes, the uptake for the age group 5 to 11 and for boosters, people coming back for more, has been much lower, at least with the city's data, and that's consistent across counties. What I'll also say is there's the widest disparity that we've ever seen within the age group of 5 to 11, where less than 20% of African-American children have been vaccinated, compared to over 80% of Caucasian children who have been vaccinated in the same age group. That is unacceptable. And again, speaks to, in my mind, 2 issues, a lack of confidence, but also access issues. So we are hoping to address that with our partners through this new initiative with Black and Brown caregivers and physicians and pediatricians in the region to really address that. Because like you said, Rodrigo, now knowing that we're gonna have this new age group that's likely gonna be approved within the next week, this disparity is only going to widen, because I think we'll see the same patterns.
Right. Well, I'm so glad we are addressing this, anticipating things. And The beauty of this panel that we know the answers now, we know what should be done, and we learn how to do those things better. So I'm very grateful for you sharing your time and information to anticipate events. So, but we still have a few mixed messages here and there. So I'll pose on one last question before we wrap up for today. So there's one of the mixed messagings that people are complaining about. Hey, we used to be told to be 14 days quarantine or 7 days, no, 5 days. How many days should I be away from work or from school? And so what is happening out there? What's the message? What should we tell folks? How many days after we got infected that we should be avoiding getting out in the community? Tell me, what should I do? Jason?
Well, I can tell you what I tell my staff. Do not, I must repeat, do not come into this health center if you have any symptoms. And if you had some symptoms, keep your N95 mask on and definitely don't budge before 5 to 7 days. That's my message as a non-physician. If you so much as sneeze, stay home. Please do not come into this health center until you are symptom-free, and then take your home test and make sure you're okay. Use the resources that the government passed out to you. Now, I'm not the clinician, but that's what's from an administrator, that's what I said.
Well, there's good sense to this, and I think Dr. Mati has talked about how things have changed and some of the confusing message. And Rodrigo, why you bring this up? And the one thing in our state is that the local public health decides exactly where that fits. Now, what has CDC said that kind of where people are making some guidance is that they've kind of gone to this potential 5 days for if you're sick, if you have COVID-19 and we want to isolate you. They have said you could do an isolate for 5 days. Now, day 0 is your first day of symptoms, so you don't get to count that as day 1, by the way. That's day 0. Okay. Then you got 5 days. And then if your symptoms are improved and you haven't had a fever being 100.4 or greater for at least 24 hours, and if you can get a test and it's an antigen test and negative, then you can come out as long as you wear a mask all the time. Now, I think we have to think about what this means, because there's ways, again, that we have to be smart as we support one another in our community, right, in this scenario. What they base this on is that 30% of people are still infectious once they hit day 6 to 10. That's exactly why they said that. Now, you don't see that published anywhere, but that's how they communicated. That's what they've said.
Right.
And so the safest thing, right? Ms. Clabon says, look, don't come here if you have symptoms at all in some respects. Now, obviously, they need to be seen different, but there's some of that. And then the quarantine piece, right? So quarantining meaning, this always gets confused to everybody, right? Because we think if I have to stay in, I'm quarantining. Well, Dr. Mati and I will tell you, we say isolate if you're sick, you quarantine if you've been exposed. Okay, so if you've been exposed, then they've also said maybe 5 days. If you've been tested and you're negative, you can come out. Again, the safest thing has been to wait, if you want to go ultra conservative, 10 days. But with Omicron, we've seen that you're usually develop symptoms much quicker. Again, in the end, those next 5 days should be masked. And we've learned masks work. They work well. And we've learned that kind of as you get better masks, the better they work. But I don't discount cloth masks over completely. The reality is we need to wear them right. Over the nose, under your chin, make it nice and snug. And I think that works out. But I hesitate to answer because I got Dr. Mati here who actually leads a local public health authority and thought she should have the last word.
I lost my mute button for a second. I'm not touching that. You handled that beautifully. That was a perfect way for us to end.
It has been a fantastic hour. I could spend another hour learning from you all, and I so appreciate your time, expertise, and your passion for making our community healthier and more equitable as well. So Angela Brown, Angela Clabon, Jason Newland, Mari, it has been a fantastic 1 hour. I so appreciate you all. And on behalf of the Brown School and the WashU, I thank you for joining us today. I thank all the audience that is out there for posing questions and being engaged. This is very important for our future and for us to get out of this pandemic better than when we started. So thank you all. Have a wonderful day. I hope we can get together soon at some point.
Thanks, everyone.
Thank
Thanks,
you.
everyone.